Brian Floyd is the president of Vidant Medical Center in Greenville, and Wick Baker is the president of Vidant Edgecombe Hospital. They were here. They got to talk to the governor and the Speaker of the House and the Senate President a moment ago. Good morning. Thank you for being here this morning. How you doing, Brian?
Good morning, Henry. Thanks for having us.
Wick, it's great to see you. Thank you, sir.
Thank you. Glad to be here.
A lot of issues, and we were just talking about some of them with the state leaders. This is crunch time, is it not? I mean, I said to all three of them, look, the medical community is the backbone of our economy in eastern North Carolina. And I know you've got some real concerns, Brian.
Yeah, obviously, these are challenging times, and let me start and just say that I appreciate so much what the legislature is trying to accomplish. It's a difficult task to balance a budget. It was interesting to hear that the Speaker acknowledged a $400 million, or the Governor rather, acknowledged a $400 million surplus in the budget, and we're constraining resources during that same year in ways that, as he said, we're not here to break the system. We want to improve upon the system. And that's where our concerns come, is obviously, as you said, that we're a $2.5 billion economic stimulus to eastern North Carolina every year. In addition to that, we're a large employer and all other things, but more importantly, we have a safety net hospital system that provides health care to eastern North Carolina, and an incredibly robust and good medical school that is producing primary care physicians, which was the very thing needed for Medicaid reform to work in the future. So we've got a very successful public-private partnership in the making over the last 40 years that is continuing to come together, be more vibrant than ever, and it's doing a very good job meeting its mission in all three of those aspects. What people usually talk about is the impact to eastern North Carolina, and Henry, that's very important, but it is also important to realize that 1 in 5 of North Carolina's primary care physicians are Brody graduates now. So this partnership is benefiting all of North Carolina. More importantly, it's specifically designed to place physicians in rural North Carolina. And it's doing that very well, and that is necessary to lower the cost of care for our entire state. So what we want to make sure people realize is beyond the safety net programs and services, this partnership works very well between private practice physicians, Brody School of Medicine, and Vidant, and the state of North Carolina as a partner in that. And what's really happening right now is what we're talking about is unwinding one leg of that stool in some respects by cutting not any one issue, but the cumulative impact of the issues they talked about between CON, Medicaid reform, the tax status for nonprofits, and this education funding that we've had for many years going down from 100% to 70%, or perhaps away altogether. The cumulative impact of these things certainly have an impact on our ability to continue to do what's necessary for our mission in eastern North Carolina and the rest of the state.
Well, as usual, Brian, you explained it very well and easy to understand. Brian Floyd, the president of Vidant Medical Center. Let me talk to Wick Baker. Wick is the president of the Vidant Edgecombe Hospital, and Wick, eastern North Carolina has some unique needs in that we've got some poverty-stricken counties, and you have. I'm sure you have your payer mix is pretty difficult from time to time. You have to service and take care of a lot of folks in Edgecombe County that don't have insurance, and this Medicaid reform is really important for you.
Yes, it is, because we're going to be there to care for patients that need care, and about 20% of our population don't have insurance. Even with the Affordable Care Act, we maintain that kind of percentage. And to pick up on what Brian said about our doctors, with the School of Medicine there, half of my medical staff members are trained at ECU, either at medical school or one of the residency programs. I believe we wouldn't have those doctors without that connection to the East, because it's difficult sometimes to recruit doctors to a smaller community.
There are three big issues here that they're going to be discussing across the street today. Mm-hmm. The one is the one we talked to Senator Berger and Speaker Moore and the governor about, the fact that the Senate budget wants to eliminate the not-for-profit tax cap. In other words, a lot of hospitals do not have to pay taxes like regular businesses. The issue there, it seems to me, is a question of educating the senators and making them understand of all the things that you do in lieu of paying those taxes, and the amount of indigent care that you offer to the people of Eastern North Carolina is off the scale compared to other areas of the state like Raleigh, Charlotte, Greensboro, those kind of things where everyone has insurance. I'm not sure that folks in the Senate really get that point.
Well, I wonder about it too, because you're either not-for-profit or you're for-profit. We're a not-for-profit. We provide in our community, in Tarboro, over $8 million worth of community benefit to our community. That includes the indigent care. It includes our staff who volunteer at schools to help with the educational programs and that sort of thing. And that's kind of the payoff for being a not-for-profit community type of hospital. And you take that away, then what? It becomes a real issue for us.
Let me go back to Brian Floyd, the president of Vidant Medical Center in Greenville. Even the Speaker of the House this morning said that a lot of people in his caucus are interested in changing that CON law. For people who don't know what the Certificate of Need law is, can you give us just a 30-second explanation of what that is? Because that's a big deal to you also.
Yeah, so the Certificate of Need law is a regulatory oversight body, basically, that allows you not to be able to just choose to do certain services that are going to raise the cost of health care by increasing redundancy of health care offerings. So you can't just decide in North Carolina to just build a new hospital across the street from the hospital or certain procedures. And what that really is all about is maintaining the integrity of the funding model necessary when you both you have some services that you get paid for, and as Wick said, some that you don't, but you're always obligated to do the service regardless of someone's ability to pay. Vidant Medical Center, we have $140 million a year in uncompensated care, meaning that we will deliver the health care and have no compensation and write off $120 to $140 million a year. We do that because we can cost shift that. And what the CON law going away does is jeopardize the fact that there are certain components of the business where we need to take that money and subsidize parts of the business that don't have any funding. It jeopardizes that if those profitable components are pulled away from us through competition that's really unfair, given that we still are obligated to provide all the care. And half the states in the country have the CON law and half don't. So it's arguable that if half have it, half don't, it obviously is only so successful. What's important to know is that we have an infrastructure that is built today through that regulation for all these years, that if you take that away, it again has the potential to dramatically break the system.
And there's also, as Senator Norm Sanderson is joining us here, we're going to get Senator Sanderson on here in a minute. Good morning, Norm. Good to see you. The other piece is the funding for medical education that really is something that Vidant uses to help to fund the Brody School of Medicine in a roundabout way. Is that not right?
That's right. We're in a model unlike UNC where we're partners with the Brody School of Medicine and subsequently the state. We do that by cost sharing the cost of both health care, indigent care or unfunded health care, and education. And in 1993, the current process was put in place with a funding model with Medicaid that allowed us to have 100% cost-based reimbursement on that. That's about a $6 million number for us, but what it does at the end of the day is allow us to help fund the Brody School of Medicine and the education programs that we provide. It's not there for just offsets of indigent care. It really is about using that money for the education purposes.
And again, that's the voice of Brian Floyd, the president of Vidant Medical Center. We also have Wick Baker, the president of Vidant Edgecombe Hospital in Tarboro. And Wick, closing thoughts from you as the legislature really gets down to the nuts and bolts now and starts to talk about how they're going to fund or not fund some of these things that are going to affect Eastern North Carolina.
Right, yeah. Well, let me say a little bit more about the certificate of need. You know, it's the difference between a free market and healthcare market is if I want to build a gas station across from yours, that's great because I don't have to give away 70% of my business under cost and another 10% where I don't get paid at all, where you might not have to do that. That's the big issue there, is that it's not a level playing field when we look at the certificate of need laws there. It's a way to keep the work that's being done in the context of it being done across the board, fair to all the hospitals concerned. So,
yeah. Brian Floyd, final thoughts. I started the interview by saying this is crunch time.
Yeah,
You're here in Raleigh today. You're talking to legislators. Are they going to listen?
Well, I think they have a difficult task, as I said earlier, and I want to
Right.
respect the fact that they have a difficult job of balancing a very complicated budget in a complicated arena like healthcare. What we want them to know is that we have been very successfully pursuing a mission that has made a real difference in the healthcare status of Eastern North Carolina, the economics of Eastern North Carolina, and is providing a real quality of life for many people through the job creation, the physicians we create. And that's beneficial not only in Eastern North Carolina, but the rest of the state, as evidenced by the number of physicians who serve all across the state. The models of how we do that today are built on the backs of these 3 to 4 issues you just mentioned that are currently in legislation. And we would need their support not just for dollars, but for stability of what is right now arguably the most successful public-private partnership that the state has.
No doubt.
And that is going to help fund and produce results through the whatever model of Medicaid reform we have, through an accountable care type environment. You have to have the kind of physicians we produce in Eastern North Carolina to do that.
Thank you both, Brian Floyd, the president of Vidant Medical, and Wick Baker, president of Vidant Educom. Good to see you, Wick.
Thank you.
Thank you for coming up today.
Thank you,
Brian,
Henry.
thank you as always. I always say this about you, but you have a unique ability to be able to really articulate the issues and make people understand it, because they're very
Thank you.
complicated.
They indeed are. Thanks, Henry.
And we appreciate all that you do for Eastern North Carolina, and we're all going to cross our fingers and keep working these guys across the street and try to make sure that we get what we need to keep our
Thanks for
economy
all
strong.
your support.